So we are going to discuss dural venous sinuses. So before that, I will tell you the dural folds. Okay. So I'll show and tell you so that you will understand very easily. Basically, we have three meningeal layers. We all know that, isn't it? We have dura mater, we have arachnoid matter, and we have pia mater. So the dura mater is actually forming certain folds which are called as meningeal folds. Okay, so they are dural folds. So how many are there? See, the cranial dura is arranged in two layers. The outer layer is called as endosteal layer, inner layer is meningeal layer, and this inner layer forms sickle shaped fold and two tents. I'll show you. So you should know all the names of dural folds. Okay, this already we have discussed tentorium cerebelli as 5 marks question. Now see here we have falx cerebri, falx cerebelli, tentorium cerebelli, and diaphragma celli. These are the four dural folds. Any of this can come as a 5 marks question. Okay, so these two layers, that means the endosteal and meningeal layers, are firmly attached to each other, except in some places where we have venous spaces called dural venous sinuses. Okay, so here you are finding sickle shaped fold of dura mater, which is called as falx cerebri. So this sickle shaped fold of dura mater is actually present between two cerebral hemispheres. So there is one more tent shaped fold of dura mater, which is tentorium cerebelli. Okay, so here exclusively you can see sickle shaped fold of dura mater is there, and tent shaped fold of dura mater is cut to show cerebellum. If you remember me telling you, tentorium cerebelli is a fold of dura mater which is separating the occipital lobe of the cerebrum from the cerebellum. Okay, above this tent you will have cerebrum, below this tent you will have cerebellum. Because this area is occipital part, you call it as occipital lobe of cerebrum. Now, this is the median sagittal section of the head and neck region, a very beautiful dissection which helps us to understand the dural folds. Okay, so this is falx cerebri. So falx cerebri superiorly, I told you it has two layers, endosteal layer and meningeal layer, isn't it? So you can see here, this falx shape, like sickle shaped fold of dura mater, it has attached margin which is attached to the sagittal suture. Okay, the internal aspect of sagittal suture, and the inferior margin of this falx cerebri is free. Inferior margin is free. Okay, so this is all falx cerebri you are finding. Okay, so along with brain, this section has been taken. So one side brain has been completely removed. This is falx cerebri. You can see this is our like medial surface of the cerebral hemisphere, where you are finding what is this corpus callosum. No, this is septum pellucidum. This is thalamus. This is hypothalamus, midbrain, pons, medulla oblongata, spinal cord, cerebellum. Isn't it? So this fold of dura mater which you are finding between the occipital lobe and cerebellum is tentorium cerebelli. Tentorium cerebelli. Now this is another view which is helping us to understand second fold of dura mater. You are finding this is tentorium cerebelli. Actually this skull cap has been removed, cranial vault has been removed. So when cranial vault has been removed, you will see the fold of dura mater is intact here. So this is tent shaped fold of dura mater, which is tentorium cerebelli. Below the tent we have cerebellum, isn't it? Then, so this is completely tentorium cerebelli beta. You are finding cerebellum inside. It is cut at the level of pons. The upper part which is attached to the middle part of tentorium cerebelli is falx cerebri. Falx cerebri. Okay, tentorium cerebelli you are finding, this is falx cerebri. Okay, now all the folds of dura maters are shown. After seeing the real pictures, I hope you will understand. This is sickle. Sickle means for cutting grass, whatever we use, that is sickle. The sickle shaped fold of dura mater you are finding is falx cerebri. It has attached margin, then it has free margin. Then this is tent shaped fold of dura mater, which is tentorium cerebelli. Below that, you have one more fold of dura mater. You call it as tentorium cerebelli. This is fold of dura mater which is seen at hypophyseal fossa. That is nothing but pituitary gland. You call it as diaphragma celli. Like that, we have four names: Falx cerebri, Tentorium cerebelli, Falx cerebelli, Diaphragma celli. Okay. Foramen magnum is a big opening in the skull bone for the passage of medulla oblongata to a continuous spinal cord. Okay. Now, dural venous sinuses. What did I say? The dura mater has basically two layers, endosteal layer and meningeal layer. Between the two layers, there is a space enclosed in some places, so that venous space is nothing but dural venous sinus. Okay, venous spaces between the two layers of dura mater. So it is lined by endothelium. It doesn't have any valves. Okay, so we have paired dural venous sinuses. I'll show you pictures. We have unpaired dural venous sinuses. The paired ones are cavernous sinus. Okay, we have greater and lesser petrosal sinus. We have transverse sinus, 2 in number. Sigmoid sinus, 2 in number. Sphenoparietal sinuses are also 2 in number. Okay, now if you look at this picture, we will try to see the folds of, now see here, this is the three stars were kept in this slide because cavernous sinus is the usual essay question which is asked. Okay, so I will show you right starting from the cavernous sinus only beta. So you are finding right cavernous sinus, left cavernous sinus. They are two in number, hence paired. You are finding one sinus here, that is the sphenoparietal sinus, which is paired. You are finding one more sinus which is paired here, S-shaped. You call it as sigmoid sinus. You are finding one more sinus which is paired here. You call it as transverse sinus. Okay. So we also have sinuses like petrosal sinuses. This is inferior petrosal sinus. Okay, we also have which is superior petrosal sinus. Okay, so this is superior petrosal sinus. So this is superior petrosal sinus, this is inferior petrosal sinus, sigmoid sinus, transverse sinus. Okay, so like that you have so many paired ones only I'm naming now. Cavernous visa, petrosal, superior, inferior, petrosal visa, transverse, sigmoid. Okay, all these visa. Okay, sphenoparietal sinus also visa. So all these are 2 in number. 1, 2, 1, 2, 1, 2. Like that. If you find in 2 number, you call it as paired sinus. There are certain sinuses which are only 1 in number. Like if you see in the midline, occipital sinus is only 1 in number. Okay, like that we have few sinuses which are only 1 in number. Like we have superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, basilar plexus of veins. I can show you two here. This is basilar plexus of veins and this is occipital sinus. They are only 1 in number. So hence they are unpaired. I'll show in another picture the superior and inferior sagittal sinuses as well. Don't worry. Okay. Now, if you observe this sickle-shaped fold of dura mater, we know this is falx cerebri. So, at the upper part of the falx cerebri, we have superior sagittal sinus, where I am scrolling this hand pointer. This is the position of superior sagittal sinus. This point is the point for inferior sagittal sinus. This point is the point for straight sinus, which is single in number. Then we have seen occipital, and see this point is inferior sagittal sinus. Okay, I told you this point is for straight sinus. Okay, now in this picture, A is labeled as superior sagittal sinus. B, no, not B, L. L is labeled as inferior sagittal sinus. Okay, K is a label for straight sinus. Rest of the sinuses are A. B is actually the occipital sinus. Okay. Now cavernous sinus. So this is our skull bone, and now we know this is anterior cranial fossa. This is middle cranial fossa. This is posterior cranial fossa. This particular point is actually called as hypophyseal fossa, where we have pituitary gland. So on either side, red in color, two areas are shown. That is actually for cavernous sinus. Okay, so cavernous sinus is situated on either side of the body of sphenoid bone. Okay, so it is extending from superior orbital fissure. I told you previously also when I was discussing like extraocular muscles. So this point is superior orbital fissure. Okay, we also saw what are the structures passing through superior orbital fissure when we were doing orbit. So anterior to this cavernous sinus, we are finding superior orbital fissure. And see, this point is the posterior point. So the posterior point is where I am keeping my arrow now. So this point is apex of petrous part of the temporal bone. Okay, so we are seeing two boundaries now. Anteriorly superior orbital fissure, posteriorly apex of the petrous temporal bone, exactly this point, apex of the petrous temporal bone. Okay, now let us see the relations. See, this is cavernous sinus, right cavernous sinus, left cavernous sinus. In between, you are finding pituitary gland in the hypophyseal fossa. And this is sphenoid bone, no? Hence, this is sphenoidal air sinus. Okay. So, if you see the cavernous sinus, laterally it is related to certain cranial nerves. So, what are the cranial nerves? We are finding here, we are finding oculomotor nerve, trochlear nerve, abducent nerve, okay, and then we are finding the maxillary nerve, okay, the ophthalmic and maxillary divisions of trigeminal. So they are forming lateral relations. Within the cavernous sinus, you are finding one artery is passing, that is actually the internal carotid artery branch only. You will see ophthalmic artery. Okay, the internal carotid arteries branch ophthalmic artery. So right and left cavernous sinuses are also connected by anterior intercavernous network and posterior intercavernous network. So this is right cavernous sinus, this is left cavernous sinus. Okay. Laterally, the part of the brain to which the cavernous sinus is related, this is actually temporal lobe, and the specific name given to this temporal lobe is uncus. Uncus. Okay. Now, so now see here, now when you talk about relations, so medially it is related to pituitary gland and sphenoidal air sinus, which I have shown you just now. Laterally we have oculomotor, trochlear, ophthalmic and maxillary divisions of trigeminal. This is Roman number of 5-1 and 5-2, not V1, V2. 3, 4, 5-1, 5-2 are the nerves which we see on the lateral wall. Okay, these are okay. Oculomotor, third, fourth, fifth, fifth ophthalmic and maxillary division of the fifth. More medially, we are finding the ophthalmic artery and the abducent nerve. Okay, then so in between, I told you we have this abducent nerve, internal carotid arteries passing like this. Okay. Again, if you want to see, this is our pituitary gland resting in the middle. This is the stalk of the pituitary gland. This is sphenoidal air sinus. Blue in color is cavernous sinus. Red in color is internal carotid artery. You have these cranial nerves. Third, fourth, 5-1, 5-2. Okay, oculomotor, trochlear, ophthalmic and maxillary divisions of trigeminal. Close to internal carotid, we have abducent nerves. Okay, so that is. Now, so once you know the relations of this, we should know the tributaries. I'll show and talk. See here. This is our cavernous sinus. We have many veins which are coming from the eyeball and then they are draining into the cavernous sinus. Okay. So what are the various veins we are finding? We are finding superior ophthalmic vein. We are finding inferior ophthalmic vein. We also find central vein of retina. Okay. So many other veins will come and they are draining into cavernous sinus. That means the veins which are actually forming a network around the eyeball, they are actually draining into cavernous sinus. Okay. Now see here. Now the question it receives tributaries from brain, from the veins of skull bone, pterygoid plexus of veins. If you remember, I was talking about venous drainage of scalp. Then I said deep facial vein, pterygoid venous plexus, through emissory vein it has connections with cavernous sinus. That's why infection from the nose region can pass via emissory vein into cavernous sinus, leading to thrombosis, that is blood clot in cavernous sinus. So it is also receiving veins from orbit, and central vein of retina is the vein from eye. Okay. So ophthalmic veins will have communication with facial vein. Hence the infection from the dangerous area of face can spread to cavernous sinus causing thrombosis, that is blood clot. Okay. So nearby veins, whatever, whether they are from skull bone, whether they are from eyeball, whether they are from brain, okay, or from the orbit, they are all pouring their blood into cavernous sinus, including pterygoid venous plexus. Okay, that is. Now see, this area is the dangerous area of face because here we have pterygoid plexus of veins. Okay, through emissary veins it gets connected to cavernous sinus. Okay, which can cause sinuses. Sorry, thrombosis. Now see here, this is our position of cavernous sinus. J is cavernous sinus here. Okay, and this is our pituitary fossa where we have pituitary gland, right? We have named paired and unpaired sinuses already. Now see here, incoming channels are over, connections we said. So once the cavernous sinus is receiving blood, obviously it has to pump the blood out. The venous network completely, the venous blood from the cavernous sinus will go to this sigmoid sinus, which is the final outlet from the veins of the skull. The veins of the brain, they are finally, they will drain into the sigmoid sinus, which will drain into internal jugular vein, because sigmoid sinus is going out through the jugular foramen and it will join into the internal jugular vein. So the venous blood from cavernous sinus through series of vein, it will drain into this sigmoid sinus. C is sigmoid sinus. Only one side it is labeled. Both are sigmoid sinuses. They will go out of the skull bone through this hole. The name of this hole is jugular foramen. Through jugular foramen, finally, the venous blood will move to internal jugular vein. From here, it will move to brachiocephalic vein. From here, it will move to superior vena cava. Okay, beta. So these are our two cavernous sinuses. Once they collect blood from orbit, skull, brain, everything, finally they will drain the things outside. Okay, that is the venous drainage outside. Finally moving to which vein? The sigmoid sinus, isn't it? No. So applied anatomy. Infections from face, orbit, sphenoid sinus can cause thrombosis. Obviously, isn't it? That is dangerous area of face. Then third, fourth, sixth, and this ophthalmic and maxillary divisions of trigeminal nerves can be involved, resulting in various diplopias. We know that because we have already studied orbit, extraocular muscles are supplied by these nerves only. Actually, these nerves which are forming the lateral relations of cavernous sinus, they are entering into superior orbital fissure, and they, from there they are supplying the orbit. We know, isn't it? SO4 I said, LR6 I said, remaining all are supplied by oculomotor. Superior oblique by fourth, lateral rectus by sixth cranial nerve, and remaining extraocular muscles are supplied by oculomotor. Hence, if something goes wrong with the cavernous sinus, if there is any thrombosis and if these nerves are damaged, then person will suffer with visual defects of double vision. The double vision is called diplopia. Okay. Then sometimes we know internal carotid artery is very closely related to cavernous sinus. If it is ruptured due to road traffic accidents where head injury is there, so it can cause pulsatile exophthalmos. In the sense, the eyeball will move, it will just bulge outwards with each beat. Okay, because here that ophthalmic artery and the internal carotid artery, they just communicate, and with each heartbeat the eyeball protrudes outside. So that condition is called as pulsating exophthalmos. Okay, pulsatile exophthalmos. Okay. So caput medusae in cavernous sinus. Caput medusae means where you will see all venous like engorgement of the blood. That condition is called as caput medusae. In case if there is any blood clot in cavernous sinus, we find such a condition. Okay. So this is MRI image where you are finding the pituitary stalk. Okay, so sometimes there may be cavernous sinus may compress if right and left cavernous sinus is enlarged, and if it is damaged, it may compress the pituitary gland also. Okay, so that is all about the cavernous sinus, beta. It's very important topic. Okay, there is a summary also here. A summary which is showing us roof is formed by anterior and posterior clinoid process with uncus of the temporal lobe and internal carotid artery. Lateral wall is dura mater, the temporal lobe and uncus only. Third, fourth, 5A and 5B cranial nerves. Floor is formed by greater ring of sphenoid bone. Medial wall like sphenoid bone, sella turcica, where we have pituitary gland, and the sphenoidal air sinus. Posterior wall is formed by the dura of posterior fossa, superior and inferior petrosal sinuses. Anterior wall, superior orbital fissure is enough. Here we have ophthalmic veins and the orbit it is leading into. No? So that is better. Draining into, these are the veins. Draining out of. Draining, what are the incoming channels we have? Superior and inferior ophthalmic veins, anterior intercavernous sinus, posterior intercavernous sinus, phenoparietal sinus, superficial middle cerebral veins. Draining out, the venous blood goes out to superior inferior petrosal sinuses, emissory veins to pterygoid plexus. This is very good summary chart. Okay. So now, see here, when you talk about the other like dural venous sinuses, we have elaborated now cavernous sinus. So we are also doing the other sinuses, like we have superior sagittal sinus and inferior sagittal sinus. So what is this? I said falx cerebri. This is the fold of dura mater which is sickle shaped and which is present between the two cerebral hemispheres. Here we have the superior sagittal sinus. Okay. So this is our superior sagittal sinus. This is our inferior sagittal sinus. This is our straight sinus, isn't it? So anyhow, all these are not required for now. So because our question is cavernous sinus. Okay, but I gave you much more information than this. Okay, so second essay is axillary nerve. Till I take you to axillary nerve, please keep reading cavernous sinus. So next question, what we are discussing is axillary nerve. So are you seeing axillary nerve on the screen? So how is the axillary nerve formed? It is coming from the posterior cord of brachial plexus at the level of axilla, isn't it? So from the posterior cord, then what is the root value we have? C5 and C6. You see here better. So C5, C6. So we know this is like posterior cord of the, like this is the posterior cord, this is medial cord, and this is lateral cord, isn't it? So here we have the axillary nerve. Ulnar, if you remember the code what I gave you from posterior cord, ULNAR, but nerve is not ulnar, but the code is ulnar, I said, and A is actually standing for axillary nerve. So you can see here the root value is C5 and C6. Okay, then now the course and relations are, it runs behind the third part of the axillary artery. on the lateral side of radial nerve and in front of the subscapularis muscle. So this one better. This one is axillary nerve. Okay, passes downwards and to the lower border of subscapularis muscle. So axillary nerve travels through quadrangular space. We will study like triangular and quadrangular spaces. I'll show you now. Okay. So thiri part is given more. Okay. I'll take you to one more PowerPoint beta. Just a minute. It's a very simple nerve beta actually. It has come as an essay question. And in order to understand the relations, we need to know that quadrangular spaces. And if it is not there, I'll take you to one more picture. Just have patience. Yeah, we got this. Are you seeing one image on the screen? Please confirm, beta. Nobody talks. It becomes difficult. Okay.
Yes, ma'am.
Oh, thank you, beta. See here, this is the, like we have certain spaces like upper triangular and quadrangular spaces. So this is upper triangular, lower triangular and upper quadrangular space. So in this upper quadrangular space, we have certain boundaries, like this upper boundary is formed by teres minor, lower boundary is formed by teres major. Laterally, you will have long head of triceps. Medially, you will have surgical neck of humerus. You have to write these relations for axillary nerve. So axillary nerve is found in upper quadrangular space. It comes out through along with posterior circumflex humeral vessels. We have studied axillary artery. Third part of axillary artery will have posterior circumflex humeral artery as one of the branches. So axillary nerve is coming back along with posterior circumflex humeral vessels, and these are the four boundaries of the quadrangular space. So once it comes out, you can see it is dividing into anterior division and posterior division. So you can see anterior division is going and supplying the deltoid muscle, and posterior terminal division is actually becoming cutaneous. That means it goes and supplies the skin. Okay, so that name is upper lateral cutaneous nerve of the arm. Okay, so basically this nerve, actually this axillary nerve supplies deltoid and teres minor, deltoid and teres minor. So this picture is the key picture in order to make you understand like what exactly is axillary nerve, otherwise it becomes difficult for you. Okay, now we will go back to our PowerPoint. So now it becomes very easy, better now you will easily understand now. So runs, this is over. See, it runs through the quadrangular space with posterior circumflex humeral artery and vein. I told you this. So branches are anterior branch winds around the surgical neck of the humerus, supplies the deltoid. Posterior branch supplies teres minor. Later it becomes cutaneous, lateral cutaneous nerve of the arm. Okay. Then the trunk of axillary nerve gives off one articular filament to shoulder joint also, and to a part to the subscapularis also. Okay. So I think link may go again. I will send. Don't worry. Axillary nerve supplies two muscles, that is deltoid and teres minor. One joint, that is shoulder joint. Okay. So as well as the skin of this area covering the inferior region of deltoid. This is called as regimental badge area. Okay. So suppose the axillary nerve may be injured in case of dislocation to the shoulder joint. Okay. Compression of axilla with a crutch or fracture of surgical neck of the humerus. Okay. So obviously the muscles paralyzed will be deltoid muscle, teres minor will be paralyzed, and it may lead to a condition called as flat shoulder. Okay, the shoulder becomes flat and loss of sensation over the area. like lateral upper arm is not having any